increased testosterone.
TRT.
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 Oh man, testosterone. Okay, these are the ones that go in my ass. Cool.
Get your testosterone treatment at home, Cobb.
Damn. Even the FM radio is like, do you want to still be natty? Nah. Are you feeling shitty, unmotivated? It's your time to get on TRT.
TRT, the new fake natty. So it's getting out of control, guys. It's just as bad as the steroid epidemic. Everyone's trying to find that edge. And so I thought it'd be cool to go get my levels checked and to talk to someone who knows what they're talking about. So that's what this video is about. And don't forget to like and subscribe, because this weekend I'm leaving to go to Turkey to get the back half of my hair transplant done. So if you're following that journey, make sure you stay tuned. And with that being said, enjoy the video. So we're here today with Josh. He's a physician's assistant, and we're going to be talking about TRT. And if you're interested in getting TRT for yourself, this is the video to watch, because we're going to be talking about all the ins and outs of TRT and if it's something that you maybe should consider. So Josh, thank you for doing this today. I really appreciate your time. So we're at the clinic. What's your clinic's name, and can you tell us more about you?
Yeah, so the name of the clinic here is Optimize You. We have 5 locations that I oversee. And my background is as a physician assistant. I've worked in corporate healthcare and then really kind of preventative medicine over the past 15 years. And I launched Optimize You Chattanooga. That was my first location in January of 22. And it's just been something that was really in me as far as helping people start to learn a little bit more about their health. We have a mission statement, which is to educate and empower you to take ownership of your health to become the best version of yourself, right? So that you miss that a lot in corporate medicine. Yeah. We throw Band-Aids on people. And so for me, it was about getting in a space where I could align with my values to let people start understanding why things are happening in their body. Oftentimes it's hormone decline as we age, and what you could do on your own, in addition to maybe some medications or supplements, things like that, that would help move the needle to make you a better version of yourself.
Cool. All right, yeah. And that's literally what this channel is all about. It's just whatever you can do to improve your life, whether it be getting a hair transplant or, TRT, whatever, to help you live a more enhanced, better lifestyle. But okay, so let's get into it, Josh. So one of my first questions, are we seeing like a testosterone epidemic in men today?
Yeah, I think you do. I think when you look at the data, there's definitely a decline as far as the number of men who are coming in at younger ages with lower testosterone. And we've got, studies around from 2007 that shows that there's about a 20% decline from generation to generation. Oh, wow. So I'll use an example. If you take a guy at 40 now and you compare him to when his father was 40, his father had a 20% higher testosterone level on average than we see now. And some of the reasons for that, I think, is our sedentary lifestyle. We're just not as active. You also see endocrine disrupting chemicals. There's things like PFAS chemicals, which we call forever chemicals. They actually came out of the military, but you can't get rid of them once they kind of attach into your body. And you can get those through inhalation. You can get them through drinking things. But we have all these chemicals, environmental changes, glyphosates and things of that nature that we're putting on chemical or on our foods. So what we ingest, what we inhale, what we wear, from deodorants to, shampoos, those kind of things that we're putting on our bodies that are lowering our hormonal balance.
Like I even hear about like microplastics seeping into our foods, fluoride in the water. Like, are those all things that?
Yeah, microplastics is a big one, and fluoride and estrogen products that so birth control that is found in water supply that has an estrogenic or a down regulation of our hormones as men that definitely plays a role in causing these levels to go down.
So, being we're speaking out about TRT, like what kind of people should consider TRT? Like at what point of your life should you consider that?
Well, I think there's twofold. I think there's a place for a young, when I say young, 25, 26-year-old guy who feels good, who needs to know where his level is, right? That he doesn't need TRT, but he actually has a baseline. And the reason that matters is because typically we see in the literature that about 35, 36 years old is when testosterone generally starts to decline, and it declines at a rate of about 1.6% annually. So if you don't have that, right? So let's say you're 45 and you don't feel well and you come to see somebody like myself. Well, you don't have a reference range for where you felt your optimal self, right? So now you get lumped into a generic reference range where you're comparing you to somebody else. So I would say, I'd say there's a place for both, right? There's a place to check your levels when you actually feel good, and there's a place to check your levels when you don't feel well. I don't know that there's an age. I mean, I've got a wide variety of patients. I'd say the most common demographic that I probably see is somewhere between 35 to 60 year olds. That tends to be when most people are kind of noticing the significant decline in their lifestyle or their attitudes or their sexual desires or what have you.
I was gonna say, are there like any particular signs like I should look out for that would be like, hey, you know what, maybe my testosterone's low?
Yeah, I mean, I think the one everybody's aware of is the decreased, sexual desires or libido. I think that's important for people to recognize, but I always I use the word vitality. When a guy feels like he just doesn't have the vigor of what it means to be a man, the desires, the motivation, the desire to go conquer something, I can concentrate on something. I've got the energy. I've got this, like innate thing in me that just wants to take on the world. When you start to lose that, that's a loss of vitality, and that can be a sign that your testosterone level is declining. In addition to things like weight gain, poor sleep, having to take naps when you get home from work. So, if you've got kids at home and you get home at 5 o'clock and they want to play ball and you're like, I just got to give me 20 minutes. It's probably not a great sign, right? So that would be a reason for somebody to kind of start looking and saying, is there something off that I need to know more about?
And speaking about kids, I know this is a big one out there. As far as like fertility, does TRT, like replacement therapy, does that affect your ability to have kids?
It does. So the way the system works, the way our body produces testosterone is through what we call the HPG axis. So the hypothalamus is a little center in our brain. It stimulates a gland called the pituitary. The pituitary then stimulates what we call gonads, which is our testes. And the testes is where testosterone is produced. So if a guy goes on testosterone replacement, what will happen is he will have a negative feedback when his level gets to an optimal range. And so as a result of that, there will be a shutdown or an inhibition of that system. So you won't have the same stimulation going to the testes that you did prior to being on testosterone. So, and it's a non-selective system. So if a guy's on testosterone, he not only will suppress his body's ability to produce it while he's on it, but he will also non-selectively reduce or suppress his sperm count. So we refer to that as azospermia. His sperm count will go to essentially zero while he's on testosterone.
Wow.
And if they come off of it, most of the studies would say he can see a resolution or a return to some degree, but it won't be back to baseline for his sperm count.
So, like, regardless, even if you're on like a small dosage, it's going to affect your ability.
It's going to likely affect you.
Wow.
Yeah. Now, here's what I'd say, the caveat. That does not mean that you cannot get somebody pregnant. So, it's not birth control either, right?
Yeah.
So you do have to keep that in consideration. There are guys who get women pregnant on testosterone therapy. So it's not exhaustive, all-inclusive, but in general, it's going to definitely lower it.
For those of you guys who know about, the hair transplant going back in June, I gotta ask, so with hair loss, does TRT affect hair loss?
It can. DHT is the hormone that is often attributed to hair loss, okay? So DHT is called dihydrotestosterone. Testosterone converts into DHT, a small percentage. So about 90% of testosterone that we produce or that we're given exogenously remains testosterone, and about 5 to 7% of testosterone that you make or that is given to you converts into dihydrotestosterone. And it's more potent, right? So it's a benefit to many, but that DHT molecule actually wants to saturate to the base of the hair follicle. So what you typically will see is if a gentleman has a genetic predisposition, where he's, you can see it in his, family history where the writing is on the wall, he's starting to see early hair loss. Testosterone can indeed accelerate that. You don't usually see it in somebody who does not have that genetic predisposition. Not saying, again, could it happen? Potentially, yes, but it's not as common to see it in somebody who does not have the genetic predisposition.
Okay, so it's like mainly you gotta look at like what your mom's dad and if you have male pattern baldness. But if you're not really struggling with those and there's not a lot of cases in your family history,
it's likely not going to impact you negatively.
Okay. All right. And as far as testosterone, moving on to the next point, would I be on testosterone for the rest of my life? Will it shut down my natural testosterone production?
Yeah. So, like, once you start it, can you ever stop it?
You can never stop it?
You can.
Okay.
Here's where this is about. I always tell people you've got to make sure you're the right patient and it's the right medication. So this is why it's not everybody needs testosterone. So if somebody's symptomatic and their levels are in the low range, and so ranges are 264 to 916, and there's different recommendations around that. So anywhere from 264 to 350 is where most societies would say that's a reasonable number to consider therapy. So if you start it at 350, okay, and you came in to see me because you have low energy, you're gaining weight, you're not sleeping well, you've got low sexual desires, you've got erectile dysfunction, so you're symptomatic. Well, if I take you from 350 and put you at 750 or 800, and these symptoms go away, and you're on testosterone for 5 years, and in 5 years you're like, you know what, I'm tired of doing this. The likelihood, if you stopped it, your body's going to kind of have a reset. It's going to take about 3 months for it to come back. Or it's not even, when it comes back, it's not going to come back to the full force, but you will produce some testosterone. But what I always tell people is, remember where you were at 350. You didn't feel good. So what often happens is when somebody stops it after 4, 5, 6 years, they'll drop back down to their level where they did not feel well, and then realize, like, I would rather be on testosterone.
Yeah.
So that's where the balance is. But you can stop it. Your body will produce testosterone again. Again, there are some things, for example, though, every year you have about a 1.6% decline in testosterone on average. So it won't necessarily be back where it was at baseline, just depending on how long you've been on it.
Got it. Okay. All right. So let's just say in a world where I was going to take testosterone, and that's something I needed to benefit and live a more improved lifestyle. How fast can someone expect to see results from testosterone?
Yeah. So what I usually tell people is about 2 to 3 weeks, you should start to see the emotional, psychological, sexual benefits. So your mood feels a little bit better. So if you're struggling with depression or anxiety, you tend to find yourself a little bit more stable after 2 to 3 weeks. Psychologically, if I've lost kind of that motivation, that drive, that energy level, that too will start to increase in about 2 to 3 weeks. Sexually, libido tends to increase in about 2 to 3 weeks. The physical changes, so that's the other part of benefit. I mean, testosterone is shown to improve, reduction of subcutaneous fat, improvement of lean muscle development, improvement of muscle strength. So that's going to take time, right? That's not going to change in 2 to 3 weeks. There's a lot that goes into that process that's going to take several weeks and months for that to kick in.
Okay, so it does contribute down the line. But it is beneficial to fat loss, building muscle.
Yeah, a study about 10, 12 years ago came out showing that a testosterone level probably needs to be around 800 from a replacement standpoint to see those benefits statistically from a standpoint of significance, in particular with subcutaneous fat reduction, lean muscle development, and increased muscle strength.
Okay. And I'm kind of curious, for the guys out there wanting to get lean and stay lean, does testosterone, like TRT, does it help you maintain being lean and having energy at the same time?
Absolutely. I mean, here's what I'd say, though. We'd be naive to think that it's an isolated event, right?
Yeah.
So people have to put in the effort. Meaning, if your testosterone level is, increased to 700-800, but your diet is terrible, you're not exercising, you're going to get limited benefits.
Yeah.
The better way to think about what testosterone does is testosterone should enhance your physical return on investment. So if I'm eating well, so if I'm prioritizing my protein intake and I'm getting rid of a lot of higher inflammatory foods. If I'm exercising, when I talk about exercise, I want to push around heavy weights, right? Resistance training matters the most when it comes to this kind of thing. Yeah. So I'm pushing around heavy weights and I've optimized my testosterone level. I'll get a substantially better result because I've done all that work.
Okay, so it's not like a magic pill. You just take that.
Yeah, not a cheat code, bro.
Okay, yeah, all right.
Yeah.
So it's like you got to do all the other things like eating right, sleeping right, lifestyle habits, and then the testosterone replacement will just enhance what you're already doing in your lifestyle.
Correct.
All right, cool. All right, so as far as TRT, what is the cost of like TRT without insurance to get set up?
Yeah, so most places that do, kind of concierge medicine or cash-based practices that I'm familiar with are going to base it around a management fee. So you'll see, depending, you've got some telemedicine clinics that may charge as little as $100 a month, some that charge somewhere around $250 a month.
Okay.
So it's going to be somewhere in that range, likely between $100 to $250. That usually includes things like your labs, your supplies, so your syringes, your medications, and things of that nature. So it's kind of bundled, but it's usually attached to a management fee.
Okay, and what's the process like as far as the initial visit, like from blood work and like what's the process like to be on TRT every month?
Yeah. So for us, the way we do it is we start with an initial lab set and consultation. So we want to see, I always jokingly tell people I want to hear from you before I even look at your lab. So I like to talk to the patient first, even though I've got your lab values ready for me to look at. And then we want to correlate, we want to connect the dots, right? So subjectively, I want to hear from you. What are the symptoms you complain of? And then look to see, do your labs match up, right? And then if it is something where it's like, okay, your symptoms and your labs confirm that this could be a benefit, then what we typically do is we'll order the testosterone. We'll kind of walk you through what it looks like. We're big on microdosing, so that's twice weekly injections at least. So because of the way the half-life of the medications work, so we don't want to do, old school thought was once a week or once every 2 weeks, but unfortunately it's a little bit more of a roller coaster when you do that. And so if you by microdosing or taking smaller amounts more frequently, you actually can create more of a steady state. Okay. And so you can keep a kind of an optimal range. So we educate the patient around that. We get them started on testosterone. We let them do self-injections. So we teach you how to use, the syringe and the needle and how to self-inject at home. And then for us, what I always like to do is recheck labs every 6 weeks until we have that individual in an optimal position, right? And that usually doesn't take forever. And then once we've got you kind of dialed in, I'll go about every 3 to 6 months on labs.
Okay, so it's a combination of checking in, seeing how you feel mentally, and then looking at what's actually going in your body.
Correct.
Okay.
Yeah.
All right, and then there are guys out there that talk about buying it offline, and so what's the difference between going to a clinic and getting it here versus just buying it online?
Well, I think the supply, right? So the one thing that we can control is where is the medication coming from, and so we're using a pharmaceutical grade form of testosterone. So it's just unpredictable. It may be a good quality product if you order it online, but you have no idea where it was made. I mean, it could have been made in somebody's bathtub, right?
Yeah.
I'll tell you, one of my patients who's been in the bodybuilding world for a long time used to talk about when he was younger, they would sell testosterone on the black market, and he would get it from his supplier, and they would take half of it out and then inject canola oil back into it because it's an oil-based medication. So they'd get half of your supply, dilute it with oil, and you'd never know it, right?
Wow.
So you just don't know what you're getting, which is a scary thought. I mean, that's the risk reward there to me is just not worth it.
Yeah, that's big. And are there any if you do get a bad batch or however you label it of testosterone, can it have bad side effects?
Well, sure, because you've got two different things I think that could go wrong. Number one, it's not a legit product, right? So, concentration wise, it's not the actual strength, so it's diluted. That'd be one problem. So you're not getting nearly what you thought you were getting. Number two, sterility. Is the product being made in a sterile environment? And that's a big issue, so, if it's not in a sterile environment, you could be injecting bacteria into your body or fungus or whatever, right? So, you could set yourself up for a disaster from an infection standpoint because you're not using a sterile product potentially.
Wow. All right. Well, that's all my questions today, Joshua. This was definitely informative. Hopefully you guys watching found it helpful. If you did like the video, don't forget to smash the thumbs up button. And Josh, thank you so much for taking your time to go through all this with me. And if you guys want to see more content like this, make sure you subscribe. And with that being said, I'll see all you guys in the next one.